Hello and welcome to this edition of John's Coffee Break. I'm delighted you're with me in the beginning, ringing in the new year, my friend. And we're going to talk today about ask a better quality of question. Yes, your outcomes are influenced by the quality of questions you ask. Let me give you an example. Many people come to me at age 62 or 63, opining, wanting to count the days, fervently as to hoping when they can retire, believing that they'd actually like to retire yesterday, live the abundant life today. But they're disheartened and believing they cannot retire early because they got to wait to reach out to touch age 65 so they can go on Medicare and be relieved of major insurance expenses for health insurance and hospitalization before age 65. But did you know there's a category out there called 501c3 nonprofits such as MediShare, which is a faith-based initiative, or Liberty Share? It's not insurance. It is actually sharing the yoke with other like-minded people in a family-like culture as far as physicians' care costs, hospitalization, etc. Now think about this during this retirement break. Number one, you're not buying insurance, so there's no premium. There's no profit incentive for United Healthcare or Aetna because they're not involved for their shareholders. And number three, you have to be healthy, so you're not subject to the mandates or the shackles of Obamacare through the ACA exchanges, the Affordable Care Act, where you have to carry the yoke for the uninsured and people that decide not to be covered, or people that have pre-existing conditions and you're paying suffocating premiums to cover those people. Guess what? If you're reasonably healthy, 61, 2, or 3, you may be able to, if eligible, subscribe to a Liberty Share membership. You have to be reasonably healthy, but guess what? The cost for the subscription is only about $199 to $259 a month. Choose any doctor. You can go to your own primary care, OBGYN, or specialist. Your out-of-pocket cost in the old indemnity style is only about $500 in a calendar year, and they pay 100% of covered costs after that, like a cash plan. The incentive for the physicians is they get paid 1.5 times the Medicare reimbursement, which is very, very attractive. At the end of the day, many of you would be able to retire at 60, 61, or 2 if you could get an alternative to health insurance that was affordable. Instead of $1,000 a month, $199 a month. Choose your own doctor and be treated with dignity. Wow, it all comes back to the tip here today in this segment or edition of John's Coffee Break, which is ask a better quality of question. The question there is, how can I get care to be ministered to in a way that I would feel dignified about without buying insurance? If you think you have to have insurance, that presupposition is going to corner you into getting the wrong answer. So ask in many areas of life a better quality of questions, because the quality of your questions and the answers thereafter determines the quality of your life. Thanks for joining me for this edition of John's Coffee Break, and have a magnificent week.